Request Dr. Vijayatha to cut short for 5 minutes. So Dr. Vijayatha is the Chief Operating Officer and Chief Scientist at Auro Biotechnologies. Based in Chennai, it is a pharmaceutical and biotechnology research organization involved in developing innovative technologies to expedite the R&D process and reduce the cost of development. Sorry.
Sure. Very good morning to all. I won't bore you up with my talk or with my lecture. Today, theoretically, everybody know that like what is nanotechnology, nanobiotechnology. You all are having the textbooks and you will know that what is nanobiotechnology, the basics and everything. But right now, I'll do one thing, like I will make you people to do product development right over here as a hypothetically. Theoretically, I'll make you to do development of a kit. So, for example, if we take a COVID kit, lateral flow immunoassay, we all know that pregnancy test kit. So, same like that test kit, we will be developing the sequential events, what we have to do. I'll give the brief over the sequential events, how to do the product development for lateral flow assays. Okay, next slide, please. This one? Middle one. Okay. We all know the definition of the nanobiotechnology that many speakers told that this is an interdisciplinary field like nanotechnology and biological principles we are using. So, if we take a COVID kit, to develop a COVID kit, we required nanoparticles as well as the biological principles like antigens and antibodies. If we want to detect antigen kit, we have to coat antibody in the paper. So, I'll show the sequential events, how you have to develop the product for COVID kit. For example, COVID kit. So these all are, this is the things like why we do nanoscale diagnostics is more important, and these things we all know that Dr. Suma ma'am also told that from saliva if we can detect many, we are having many biomarkers in saliva. If we are focusing on those things and if we can detect from saliva itself, we are taking as a sample, and if we can detect from saliva, we can able to serve our country. So like a point of care diagnostics. So pregnancy kit you all know, right? So everybody can test it. Like by their own they can test it. Everybody can test it. So we'll go for COVID kit. No? So we are taking the gold nanoparticles here. Gold nanoparticles, as a lecture we know that 1 to 100 nanometer size gold nanoparticles we have to choose, and we have to take the gold nanoparticles. So from there we have to bind with the antigen. If we are developing the antibody kit, we have to bind with the antigen. So COVID, first of all we have to detect what is the sample, and next what we are going to detect. From there, if it is antigen test, we have to coat antibody. If it is antibody test, we have to coat antigen. So next is the like lateral flow. So I am discussing about the lateral flow assay, like a pregnancy card type of kit we are doing right now. So after combining with the gold nanoparticles with the antigen or antibody, we have to coat them on the lateral flow nitrocellulose membrane. So after coating them on the nitrocellulose membrane, we can able to assemble. We are going to assemble that in a cassette. Like final product, you will see in the pregnancy kit, right? So like that, we have to assemble the kit. So we will be having right now like the control line as well as the test line. If we are adding the sample, control line is must for all the kits. So control line, if we are getting the control line, that is a like test is a positive. like test has not have any complications to detect. So if it is, again one more line it is coming, like a test line is also amplifying. Test line also, like if you are going to visualize the test line, then that is a positive case. If you are not visualizing the test line, that is a negative case. In the pregnancy kit also, like if you are getting the control line, anyways everybody will get the control line. So if you are getting the test line, like that is a positive. If we are not getting the test line, that is a negative. So these are the advantages. Okay. So nanobiotechnology introducing in diagnostics is a very, very advanced technology. Why we are speaking? Because with the nanobiotechnology, we can able to detect from saliva samples, from urine samples, and from blood sample. We can detect the cancer from the blood, direct blood, not go to the biopsy, and we can detect. And also, if we are having any issues, we can able to detect them in saliva itself. So you people have to focus on the product development, and your idea should be more practical, and how we are implementing that into the practical oriented thing, and how it is useful to the society. So if we are focusing our studies on this line, and if we are preparing our studies, so everybody will become an entrepreneur here, and and they will definitely bring up with the new technologies and very innovative technologies. Right now, this is a point care diagnostic kit. So it can go to any level of rural place. So whole India we can able to serve it. So not even one company we cannot able to give to whole India. So many people from you should come up with new technologies, and you should know how to develop a product, and you should incorporate your, like you have to write down that how to develop a product. So sequential events you have to write, and you have to prepare your own product development, and you have to work for it. Thank you.
Thank you, Dr. Vijayata. Thank you so much on time. And I think students, you please contact Dr. Vijayata for any questions.